Once again, good morning, good afternoon, good evening, everyone, depending on where you're joining us. My name is Martha Meles, and I'm a Senior Program Specialist at Canada's International Development Research Centre, IDRC. It's my pleasure to welcome you all today to this event on COVID-19 and informal workers, featuring the work supported by the IDRC. This event is jointly organized by IDRC's long-standing partner, WIEGO, who carried out the research we will be hearing about shortly. I'm joining you today from IDRC's head office in Ottawa, Canada, situated on the traditional and unceded territory of the Algonquin and the Anishinaabe people. I'd also like to recognize that you're joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. In a few minutes, we'll be hearing from our esteemed panelists, but before that, a few logistics. If you would like to pose questions or comments to the speakers, please use the Q&A box at the bottom of your screen. We will be recording this event and we'll make it available on our YouTube channel. We have an active social media presence, and we will be posting the Twitter handle and social media tags in the chat shortly. Please share your takeaways with us. Without further ado, I would like to pass the virtual mic to Erin Tansey, Director for Sustainable Inclusive Economies Program at IDRC. Erin will be moderating the event. Over to you, Erin.
Thank you so much, Martha, and good morning, good afternoon, good evening to all of you. I am also based here in Ottawa, Canada, and I am absolutely delighted to be moderating this event. IDRC is very pleased to be partnering with WIEGO on this very important and timely work. So before I introduce the speakers, let me say a few words about IDRC's broader work on the COVID-19 response, within which the research you will hear about today is nested. So as we know, the COVID-19 pandemic has had and continues to have a tremendous toll on human life and livelihoods. It threatens to erase decades of progress, including towards gender equality. IDRC is supporting timely, contextualized, and robust evidence to support recovery efforts in low and middle income countries where the need is the greatest. So one of our flagship initiatives is the COVID-19 Response for Equity, or the CORE initiative for short. This is a 3-year, 25 million Canadian dollar rapid response initiative that IDRC put in place last March. The goal is to support high quality, innovative research to inform equitable responses to the COVID-19 crisis, particularly those that target and engage women and marginalized groups to shape and benefit from effective responses and recovery efforts. So we mobilized our established networks of research institutions and think tanks in developing countries to fill the urgent need for social and economic policy innovations as countries grapple with the growing economic fallout of a global shutdown and eroding social cohesion. We are currently funding research in 42 countries under this initiative. This initiative is therefore generating data and evidence and is contributing towards a better understanding of the social and economic impacts of the pandemic. They're also informing actions to build more resilient and inclusive economies. So the research findings that we'll hear about today are part of this initiative and focus on how the pandemic is impacting informal workers and the kinds of measures that need to be put in place to ensure that no one is left behind. So some 2 billion workers globally are in informal employment. And in developing countries, this accounts for almost 90% of workers. And they have absolutely been hit the hardest by the social and economic fallout of the pandemic. So as we'll hear shortly, informal workers are highly heterogeneous, and the pathways through which they are impacted by the pandemic and what measures are needed to build resilience will vary depending on the category of workers and the regions that they're working in. Similarly, there's also a gender dimension to the uneven impacts. Women are overrepresented in precarious and informal work, where the socioeconomic impacts are acute. So the rise in care responsibilities has exacerbated pre-existing gender disparities. Digital inequalities in terms of the unaffordability of devices needed to access schooling, work, and social grants is greater for women and female-headed households. Disaggregated data and evidence are crucial for informing appropriate and targeted policy responses. So with funding from IDRC as part of the CORE initiative, WIEGO is collecting data from 11 cities across the world on how the pandemic is affecting different categories of workers and also the gendered nature of that, focusing on home-based workers, domestic workers, street vendors, and market traders, as well as waste pickers. So I'm pleased to announce the release of 2 reports that unpack survey findings from the first wave of data involving over 2,200 workers in cities across Asia, Africa, Latin America, North America, and Eastern Europe. The first is the global summary findings. And the second one is a report entitled Distinct Pathways of Impact and Recovery. So we'll be posting the link to these reports in the chat. The reports will also be available on both the IDRC and the WIEGO websites. So the panel today will shed light on the findings from this in-depth study. And we have with us today Marty Chen, who's a senior advisor to WIEGO, Carmen Roca, who's a WIEGO focal city coordinator in Lima, Peru, Sally Roever, who's an international coordinator for WIEGO. We also have the privilege of having 3 informal worker representatives. We have Gloria Solarzano. She's the leader of the Red Nacional de Trabajadoras y Trabajadores Autoempleados, otherwise known as RENATTA, from Peru. We have Manop Kaewphaka. He's the president of the Federation of Informal Workers in Thailand. And we have Poonsap Tulaphan, director of HomeNet Thailand. So Marty will kick us off with a brief overview of the report, and then we will move into a panel discussion. Following that, to get the view really from the ground, what's happening on the ground at the moment. So that's more than 1 year into the pandemic. So we'll want to know, what has changed? What's been the response so far? What's working and what's not working? And where do we go next? And then we'll have time at the end for a panel discussion, at the end of the panel discussion for Q&A. So I really do encourage you, like Martha said, to post your questions in the chat box, and we'll be monitoring these. So I want to just acknowledge as well the immense pain and suffering that is happening right now in so many of these countries, Thailand and Peru included, as a result of this now 3rd wave of COVID-19 pandemic. So I now am going to invite Marty Chen to give us an overview of the key findings and set the stage for the panel discussion. Over to you, Marty.
Thank you so much, Erin, and thanks to IDRC for supporting the study, and to Martha Meless, who has been with us throughout the study and given such support. And I am also wanting to thank the local partners who partnered with us on the study, local organizations of workers, as well as local researchers. And I'm so delighted that we have representatives from 2 of the study cities on the panel. I'd also like, of course, to thank my WIEGO colleagues beginning with Sally Roever, our international coordinator, but all the members of the COVID crisis study team. Next slide, please. To set the context, I think it's important to realize that the COVID-19 pandemic is also a recession, and it has distinctive features compared to earlier economic crises. First, of course, that it's both a public health and an economic crisis. The other is that the economic crisis started in what's called the real economy, not the financial economy. And this time, informal workers were widely recognized as disproportionately impacted, while in earlier crises, the informal economy was seen as a cushion for formal workers to fall back on. And this time, the crisis is preceded by the first ever global estimates of informal employment, which Erin kindly shared with you. Next. In May last year, the ILO estimated that 80% of informal workers, 1.6 billion informal workers, would be among the most severely affected by the pandemic recession. And during the first month of the crisis, informal workers were estimated to have lost between 60 and 82% of their earnings. Next. The WIEGO-led study supported by IDRC confirms the ILO 2020 estimates, but it also, and this is the unique value added, provides grounded, nuanced understanding of the dynamics of impacts on different sectors of informal workers and within sectors on women and men. So we've looked at the degree of impact, but also the pathways of impact on the different sectors, women and men. And we suggest that the pathways of impact provide pathways to recovery for these different sectors of informal workers, both women and men. And I should note that round 2 is underway currently, as this is a longitudinal study. Next. So the study was carried out in 12 cities, in 10 countries, in 5 regions of the world, highlighted in the map. In this report and presentation, we do not include the findings from Dar es Salaam in Tanzania because during 2020, the government of Tanzania denied the pandemic was happening and did not impose lockdowns or restrictions. The sample is 4 main sectors, as Erin mentioned: domestic workers, home-based workers, street vendors, together with market traders, as well as waste pickers. And the sample being reported on is just over 2,000, 73% of which are women. And again, I want to call out our local partners, the organizations of informal workers in each city, as well as the local researchers. Next. The study methods included a survey questionnaire and in-depth interviews with informal workers, their leaders, their organizers, and other stakeholders. In both round 1 and round 2, the survey and interviews took place in mid-2020 and mid-2021 in June and July. And both rounds have a recall, 2 recall periods actually. February 2020, pre-COVID last year, and April 2020 for the peak restrictions. And this round, the recall periods are the previous month and the last 12 months, because we're really trying to understand what's been happening since round 1. And I should say that the methods were designed by the WIEGO Crisis Study Team in consultation with our local partner organizations and field tested in several cities. Next. Next, please. I included this slide because it fits with the title of the webinar, that you can't have recovery if you don't include the informal workers. And this slide shows informal employment as a share of total and urban employment in the study countries. And I've highlighted in green in both the total employment and urban employment columns the countries where informal employment is substantially above half of total employment or half of urban employment. The share is always lower in the urban areas because that's where you find formal workers. Next, please. So what were our common findings across cities and sectors? Next. I've got 2 slides to summarize. The lockdowns and restrictions in April 2020 led immediately to a triple crisis of work plus earnings plus food security. At that time, only less than a quarter of the workers were able to work, and their average earnings compared to pre-COVID earnings were 19%. By mid-2020, as the restrictions were eased, recovery was slow. About 21% were still unable to work, and average earnings were around 56% of pre-COVID earnings. And we heard a common refrain around the world: we will die of hunger, not the virus. Next. The lack of work and earnings plus inadequate relief forced the sample households to pursue adverse coping strategies, which left them triply disadvantaged for recovery. The government relief efforts were uneven and inadequate. Only 42% of sample households received cash grants and/or food aid. Most of the government aid was one-time, small amounts, and was facilitated and supplemented by the local organizations of informal workers. And the sample households therefore had to resort to adverse coping strategies. 44% drew down savings, 41% borrowed money, and 10% sold or pawned assets. And many resorted to a strategy that we had put into the questionnaire, which was postponing paying rent, utility bills, and school fees, leading to mounting debt with compounding interest. And this left the informal workers and their households triply disadvantaged for recovery because of the increased debt, the depleted assets, and the postponed payments. Next. So here is how a home-based worker in Ahmedabad, India summarized the situation. During the pandemic, debt increased drastically. People were compelled to take loans at a 30% interest rate from the owners, the contractors, the traders for their food requirements. They could not ask for money from their relatives who had also met with the same fate. It was such a difficult time that the women had to run the household by going into debt. Next. There are significant differences between the cities, which I will not summarize in this presentation, but I do want to mention the main reason for these differences. First of all, the composition of the sample. It was quite different in the different cities. What was also different was the intensity and duration of lockdowns or other restrictions, the coverage and amount of government cash or food aid, and very importantly, the local government stance towards informal workers, both during and after the lockdowns or restrictions. During the lockdowns, the question was whether the local government deemed some informal workers as essential, and if so, whether they were allowed to work and provided with protective equipment. And after the lockdown or restrictions were eased, whether local government treated the informal workers punitively. And we heard from different cities around the world about harassment, bribes, confiscation of goods, destruction of work sites, and evictions. Next. But what I'm going to focus on is this degree and pathways of impact by the sectors. Next. So this table summarizes the degree of impact by sectors using 2 indicators: not able to work and average earnings as percent of pre-COVID earnings for 2 periods of time for the 4 main sectors. And I've highlighted in green the worst effective sector for each indicator in the 2 time periods. So you'll see that home-based workers were the most affected, worst affected, and that domestic workers were the least able to work in the mid-2020 period. And what's also perhaps surprising is that as a group, the waste pickers were relatively less impacted, in part because they are employed and they sell what they are able to reclaim from the waste to others who are self-employed, whereas the street vendors would have to sell to customers who may not have the means or the demand. Next. We also, through both the quantitative and the qualitative research, found out about the distinct pathways of impact by sector. For domestic workers, not surprisingly, it was the attitude and hiring practice of the employer. But what we found was that this was very different for live-in versus live-out domestic workers. Home-based workers, many of whom were garment makers, there was decreased overall demand, domestic and export. There was a closure of factories, both textile and garment. And of course, there was decreased local demand. There were fewer customers, buyers for the self-employed, and fewer work orders for the subcontracted. In regard to the street vendors and informal market traders, there was decreased demand for non-food products during the peak restrictions. There were closures of the natural market of the street vendors, as well as the built markets of the informal traders. There was closures of wholesale markets, making it more difficult and more costly to access stock. And there was increased prices for stock and decreased prices for goods sold. And in terms of the waste pickers, there was a decreased overall supply of waste generated. There were closures of dump sites and sorting areas, and there was decreased demand and prices for the recycled waste. Next. So I have a set of slides, pair of slides for each of the sectors, one with some data points, the other with a photo and a quote. So among domestic workers, those who lived out were hit harder than those who lived in. And this bar chart shows earnings as a proportion of pre-COVID earnings in April and mid-2020. And you can see for the live out on the right that it was significantly lower earnings. Next. This is a live out Mexico domestic worker, quote from a live out domestic worker in Mexico City. I worked for a woman who is a single mother. She stopped calling because she was afraid that I would come to her house with a virus. And well, she fired me. She did not pick up the phone again. They see us as a source of transmission. Next. Among home-based workers, the subcontracted were hit harder than the self-employed. And this bar chart figure includes 2 indicators, the percent not able to work and the average earnings compared to pre-COVID earnings. And you can see that the subcontracted were less able to work and had recovered their earnings, were less able to recover earnings. Next. So it's not that the self-employed were not affected. Here's a quote from a self-employed home-based worker in Pleven, Bulgaria. And I should add, for those who don't know, that home-based workers are those who produce goods and services from within their own homes for the market. So this woman said, we weren't able to work during the pandemic. More precisely, our city was under lockdown restrictions. We couldn't go out to sell our products. Next. Among street vendors and market traders, those who sold non-food items were hit harder than those who sold food items during the peak lockdowns or restrictions. But by mid-2020, the average earnings of non-food vendors and traders had recovered more. So you can see this is average earnings bar charts. Next. A market trader and Accra, Ghana put it this way: we, the traders, are mostly subsistence traders living on our daily earnings. So in effect, we spent all our little savings in this period. If you bought goods on credit and sold them and had to pay the creditor, you were forced to spend the amount due because you did not have any other source of income to live on. Next. Among waste pickers, women were hit harder than men. And this chart shows their earnings as a proportion of pre-COVID earnings in the two periods of time. Here is a quote from a woman waste picker in Dakar, Senegal. And I wanted to say, we surmise that the two reasons why the women waste pickers earned less. One is that they were less able to compete for the decreased waste available and for the decreased demand for the recyclable waste. It also depended whether they worked and whether they collected the waste from households, from businesses, on the streets, or at the dumps. And here is a quote from a woman waste picker in Dakar, Senegal, who worked on a big dump in that city. I came from working at the dump, and at the end of the day, my employer told me that he didn't have any money because he had sold nothing. So I just had to go back home. Next. So I've tried in this slide to summarize the differences between women and men. Overall, women informal workers fared less well than men informal workers within sectors and overall for the sample. This is because women were overrepresented in two sectors that were particularly hard hit. That shows you in that summary table. Domestic workers had the least decline in earnings in April, but were least able to work in mid-2020. And home-based workers suffered both the greatest decline in work and earnings in April and the least recovery in earnings by mid-2020. Women also experienced greater declines in work and earnings and slower recoveries than men in the two other main sectors, reflecting where they worked, what they sold, and their ability to compete compared to men workers. They also had greater concerns about health risks and higher increase in household responsibilities than men workers. But in terms of the unpaid work, we found overall a somewhat higher percentage of women than men reported increased time spent on unpaid work. But it should be noted that in 6 cities, more than half of both women and men reported increased time spent on cooking, cleaning, and care work. Next. So to summarize, there was a significant decline in work and earnings as the ILO predicted. By mid-year, there was substantial recovery in ability to work, but modest recovery in days of work per week and in earnings, with ongoing punitive measures by local government in many cities. The impact and recovery differed by sector and within sector by sex. Government relief was uneven and inadequate. The coping strategies led to increased debt, reduced assets, postponed payments, the triple disadvantage for recovery. And between women and men, the differences were determined in large part on what sector they worked in, and within sectors by key variables such as place of work and type of product or service, pointing out the need for intersection analysis in any such interpretation of findings. And finally, just to say that their study outputs have been many. We've launched the round 1 global summary and the WIEGO working paper that Erin mentioned today. So thanks for the launch, IDRC. But there are city-level fact sheets for the 12 cities. There are policy insight documents on certain related policy issues. And there's a very important summary of demands by informal worker organizations, including a very detailed platform of demands by the Federation of Informal Workers we'll hear from now. And there are 2 articles forthcoming in the special issue of International Labor. review on COVID and work. Thank you. Next. Thank you.
Thank you so much, Marty. That was a fantastic overview. What a rich set of results that you have. Really interesting stuff. So, you know, Marty has just highlighted the pathways through which the pandemic affects informal workers and how those pathways vary. But one thing that is consistent across is that it is gendered, as Marty pointed out. So with women being disproportionately impacted across the different category of workers. The government relief efforts are an important source of support with massive expansion of social assistance policies, but reaching those most affected by the crisis really does continue to be a challenge. So I'm now going to turn to our esteemed panelists to hear about how this has played out in 2 of the cities where the study was conducted. And I'm sorry, Marty, I made a mistake. I said 11 cities, but you're right, it's 12 cities. So today we're going to look at what's been happening in Lima, Peru, and also in Bangkok, in Thailand. So these cities have both been severely impacted by the pandemic, and they're currently, as I mentioned, really battling with a third wave of COVID-19. So I will start with you, Kun Manop. As we have seen from Marty's presentation, home-based workers are the groups most negatively affected in Thailand in terms of earnings and ability to work. So can you tell us a bit more about what you're seeing on the ground and how these home-based workers are managing amidst the third wave of COVID? Kun Manop, over to you.
ครับ สวัสดีครับ สวัสดีครับ ผมมานพแก้วพกานะครับ เป็นนายกสมาคม
My name is Manop Kaewphaka, Director of the Thailand's Informal Sectors Informal Workers Federation. My organization actually have found the Federation of Informal Workers of Thailand, so composing of the informal worker, domestic worker, motorcycle taxi driver, and street vendors in Thailand. Because of the pandemic, from the first wave to the present, the situation is worsening. The first wave had been very difficult because at first we think that it is going to be a short pandemic over a month or 2. And we can manage the pandemic. The informal sector usually who are home-based workers does not have any financial plan and they do not have other secondary source of income. So they are like subsistence workers who actually works and spend their money for livelihood day by day. So after the first wave, they have ran out their savings. So in December, the formal workers, especially state vendors, domestic workers, home-based workers, have not fully recovered. They have not have orders or job, and then they were hit with the second wave of the pandemic. We actually do not have the order, and we have to type like sell or pause our properties or our gears. So when we do not have anyone to turn to because our relative as well as friends and colleagues are in the situation. That was the situation in the second wave. Now with the third wave, it is just like making us feel even more impoverished. I feel just like being despite just like being arrived. The situation in Thailand hit 9,000 8,000, almost 10,000, and the government have limited testing facility. This is very difficult for us to access the testing facility in government hospital and private hospital. They do not accept testing. So each day there are thousands of people, but the testing facility cannot accommodate thousands of people. They have to camp in the mobile testing unit. Some people do not get tested immediately within a day. And people who were tested positive, thousands of them are waiting at home isolation because they are not assigned to the hospital and facility. Dozens of people or a couple of dozens of people die at home without accessing the treatment in a medical facility. People who are dubious of their testing result feel that they are paranoid about the situation and they have suffered mental health because they just worry whether I will get infected or not. My group actually sent 13 persons to testing, 5 were tested positive. They were waiting at home isolation for 5 days before accessing treatment. In the past 5 days, 8 more of people in my group have gone to the testing, and then 6 more that were sent to test recently. 6 more were tested positive. I think 2 of them are waiting the result. They have not get tested that. I think they are going to be positive too. Many people want vaccination despite the know that the government vaccination program is not efficient to prevent the COVID, but we do not have enough vaccination for the people. In Bangkok and the Greater Bangkok, the situation contributed to inequalities, and the government do not have appropriate remedies for the people. For example, recovery package, access to medical facility, as well as social security remedy package. The police or the military, the member of the armed force can access vaccine first and foremost, comparing to the informal people. When we don't have the spotlight, when we are not famous, we are not going to receive any kind of medical attention. I go to the testing facility at 2 in the morning and I get tested at 11 the next day. Many people actually have to sleep on the street waiting for that queue for COVID testing. I go 2 a.m. I get tested 11 a.m. That was considered very fast. People are unemployed from the first wave, the second wave, and we actually have not even 10% recover in the third wave. People need to rely on many adaptive strategies. For example, I used to work at normal price and everybody is doing the price cutting. It's just like Marty have said that the market have closed, no orders, but people have to compete in cutting down the price, and people are unemployed. They have to sell their equipment. They become food vendor. That is just more make the situation of the street vendor, food vendor more competitive. It's making the situation more difficult to different sectors. Some people decided to return home because they cannot afford the utility bill and the rent. I don't know when will the situation will improve. I don't know whether I can go back and resume my occupation in the garment sector. We suffer a lot of mental health problems. I don't know whether we can survive until the economy have recovered. This is a general situation in Thailand. I think things are getting worse. Thank you.
Kaewphaka, Kun Manop. Wow, it's very difficult to hear all of that you've just shared with us, and the dire situation and the lack of testing, the time it takes for testing. It's just incredible. But thank you so much. So now let's hear about how the situation is playing out in Peru. Gloria, your organization, the Network for Trabajadores y Trabajadoras Autoempleados, excuse my Spanish accent, has been in the trenches working with and representing informal workers in Peru. What are you seeing on the ground, and what do you see as major gaps where policy action is needed? Over to you, Gloria. I see you there.
Good morning to everyone. I am Gloria Solarzano. I am the representative of the self-employed National Network of Workers, RENATTA. I'm going to speak about informal workers, especially based on street vendors. The situation of street vendors in Peru is of high risk, but due to the pandemic, it has become even more difficult because the government policies were not appropriate for this situation, and they blamed our sector of street vendors. And they started evictions. To them, the markets, the galleries were the places where the infections were taking place. So we were out of work. We started a quarantine for 6 months. We couldn't work at all. And these workers work for their livelihoods on a daily basis. If you don't work, you don't eat. So if there's a quarantine or restrictions, it was risky, and we had to find ways of supporting each other's. Home-based workers had to help us. We created networks to help each other. As you can see, our work is in public spaces, and the emergency made us look for spaces in the central parts of the cities, in the different municipalities. Many persons had to go to the center of Lima because there were more people there and more possibilities of selling, with the risk of being taken. Our merchandise, our products were taken by the government. But we had to work, we had to take the risk to earn our living. Street vendors, for many years, we have created an associative savings that helped us over time to be formalized, to have a space, a market space, to guarantee their economic development, for them to sustain their families. But due to the pandemic, that plan could not be carried out. Many comrades had savings. Some of them had bought land or had the possibility of building their houses, were affected. But we had a dialogue. We asked for a dialogue with the authorities. We want them to listen to us. We want to have our savings. The only way for us to progress, to guarantee our work, is through formalization. That's why we want the government to comply with the Decree 1787, because it mentions, it states that savings have to comply with a certain legislation so that we can achieve our goal of having a space where we can work. Now, we want to go back to work. Until now, many organizations, at least RENATTA, were not able to work. We do not have the possibility of going back to the place we used to work, although we have projects to start building. If we don't work, we cannot build. We cannot ask for a loan. For us, formalization is a very important point, so we can buy our land. When we get older, we cannot work, so having this space to work is a way of having an income for the elderly. In economic terms, our hands were tied. Due to the pandemic and the confinement, we had to create our capital. We had to sell our products. And some could not afford paying the rent of these market spaces. Street vendors increased in the streets. We had to ask for loans to increase our capital to pay for our market spaces. But if we request loans, we need low interest rates. So I asked the governments, as they gave loans to the business persons, we have the right of having the same treatment to access low interest rates in the loans we ask for. Regarding health, our sector, we don't have any health protection. During the pandemic, we had to move forward with our own resources. We had to resort to traditional medicines, herbs, and many other ways of supporting each other. There was no opportunity of going to the hospital and find a bed. If there was a bed, we couldn't pay for the oxygen. There was no way of recharging oxygen tanks. You had to wait for 4 or 5 days to get the oxygen and the medicine. They didn't give us the medicine. For our sector, not having resources to access hospitals and buy medicine was very serious. We decided to stay at home. I decided to stay at home, help each other in moral terms, in economic terms, in order to keep moving forward. The state is not present, and now we are trying to find a way. The pandemic continues. We are going through the third wave, and our work entails a very high risk. That is our situation. We have comrades in a very serious situation, not only because of the pandemic, because of other illnesses as well. We do not have economic resources. We are fighting so that the authorities listen to us so that we can go back to work. So evictions must stop. We are going to work as we can, fighting every day, fighting with municipal officers for our land. There's no aid for this sector. There's no dialogue with the government. They do not receive our proposals. So we are trying to find a way out as we can. That is the situation of street vendors here in Peru. Thank you.
Gracias, Gloria. Just incredible
Thank you, Gloria.
You know, on the ground realities of what informal workers are facing in Peru. And I commend you and your organization for really trying to seek solutions with the government and amongst yourselves, just to make it through the next days, the next weeks, the next months. So let me move, continuing with Peru, but asking Carmen now to come in. Carmen, from your point of view, what has been the response so far, and what is working and what is not working in Peru?
Carmen, we're not hearing your sound. Still no.
Yes, we can hear her.
I can hear her also. Yes, I can hear you. And can the interpreters hear you? I hope so.
Yes, we can hear
Okay,
her.
thank you.
Great. I was saying that Gloria is one of the estimated 500,000 street vendors in Lima, Peru. Now you would say Peru, the Andes, South America, mostly rural, right? But no, Peru is a 70% urban country. And if we take out agriculture, and if we take out farming and fishing, still 65 of every 100 people who are working are doing so in informal employment. And the largest segment within those are not people who work in micro and small enterprises. There are people like Gloria who are independent, self-employed, own account workers who have created their own jobs. They didn't get them from government or from a company. And as she said, survive on their daily earnings. Now, if you were government, what would you do? You know your health system is going to collapse in no time, and you know the composition of your workforce. You know you have to send everybody to lockdown. So, you know, you have to channel food to them. So what are the policies that were put into place? Food was supposed to be channeled through local governments to the most vulnerable population in their municipalities. That was a mistake because of the poor capacity of local governments and because of corruption in them. The other measure that has been the flagship measure has been cash grants so that people could have access to food. The amount has been in the area of $200 only one time and split in two payments. And it was announced from the beginning as a cash grant for people living in poverty and extreme poverty. But the feedback was that it wasn't reaching the population. So another cash grant was issued for independent workers, people like Gloria, after a lot of advocacy from civil society. But the feedback was that it wasn't reaching people. So another cash grant, this time for families, and it was called a universal cash grant. But the feedback is that it is not reaching people. So what was the problem? After 12 continuous years of economic growth in Peru, poverty and extreme poverty was found in rural areas. We have had a Ministry for Social Development only for 10 years. And during those years, the information, the directories on vulnerable population in rural areas is of superb quality. It's like census data. However, for urban areas, it was of very poor quality. And it is not that you sign up or you apply or you register to be a recipient of the cash grant. You have to appear in the list of recipients that the government issues. Now, the Ministry of Finance decided that they would not take information from organizations like Gloria's, RENATTA, of their members. They would only take information that was generated by government. So even the list of members that RENATTA, Gloria's organization, has, that is in the public registrar's office, that is in the municipality, that list was not taken into account. So that was a big problem, and it has been a continuous problem. Another cash grant, a very good option, of a small amount, $50 per month, has been issued to orphans who lost one or both parents to COVID. And credit has been made available at almost zero cost to enterprises, but completely inaccessible to workers like Gloria. There have been policies, of course, at the local level as well. The first one has been evictions. So what happens? Mayors want to show the population in their municipality, in their jurisdictions, that they're doing something, that they're concerned about health and about order. So they evict people who are working on the streets. They close open air street markets. They're called paraditas in Peru. And they close the stalls in markets that are not selling raw food items. So if you want to have a fruit juice, buy a ceviche, or if you want to buy a t-shirt or pajamas for kids who have already outgrown theirs and winter is starting, you cannot. And a lot of people are left without work. So somebody has to be blamed because we came in fourth in the America Soccer Cup this weekend, but we came in first in the world for deaths among 100,000 people, first in the world. So who are stigmatized and blamed for this? People who work in markets. In spite of markets being leaders in implementing measures for their work to continue in sanitary ways. So what would help as policies going forward? Gloria has mentioned already, credit available in small amounts. Why? Because people need to rebuild their working capital because they literally ate their working capital. Facilitate spaces where to work. It has worked in a couple of municipalities that open air street markets, implementing protocols, schedules, were able to work during the pandemic, during the lockdown. So it can be done. Speaking about domestic workers, a very important sector in Peru, by December 2020, the year of the pandemic, there were 122,000 less domestic workers in the National Household Survey compared to 2019. If these were employees of our corporation, there would be a rescue package for that company. So they need alternatives of employment and they need credit available in small amounts to start new economic activities. And just to mention waste speakers, Erin, because they were the hardest hit sector in the survey in Lima, they had the most expensive protocols to be able to get back to work. And to end, I just want to highlight one very important thing that we found in the surveys, the dignity of my compatriot workers. They continuously said, we don't want cash grants. We don't want anything for free. We want government to allow us to work. Without my work, I am nobody. So that's a quick summary. Thank you.
Thank you so much, Carmen. Really well, well presented and well explained to us what some of the major problems are and some of the potential solutions. So fantastic. Let me now move in and ask Kun Poonsap from Thailand to speak. Kun Poonsap, you and Kun Manop are here representing the Federation of Informal Workers of Thailand, which represents workers from across a variety of occupations. So can you tell us how you're supporting members and advocating for supportive policies during this period? And have there been any successes?
ครับสวัสดีครับก็พูดแทนคุณพูนทรัพย์บางส่วนก่อนนะครับถ้าขาดเหลืออะไรคุณพูนทรัพย์ก็จะช่วยเสริมให้เพราะคุณพูนทรัพย์ยัง
So I'm going to speak on behalf of Kun Poonsap because she's not ready yet because one of her family members just passed away.
รวมกันแล้วก็ทำเรื่องข้อเสนอไปถึงรัฐบาลเมื่อวันที่7 ธันวาคมก่อนที่เราจะทำข้อเสนอให้กับรัฐบาลนั้นรัฐบาลก็ได้ช่วยเหลือเราครับรัฐบาลก็ได้ช่วยเหลือในเรื่องของการเยียวยาให้กับเราครับโทษทีกลับมาคืนครับ
I'm not hearing you very well.
ขอโทษครับเสียงล่ามเข้ามา
Okay. The government have assisted us to with the cash grant, even though it is not quite effective, and when we think that is hardly enough. And I think like with this situation during the second wave, we have the recommendation for the government on the 7th December 2020, and then like this year in January, we have follow up with our recommendation to the government. We have like 8 issues that we have proposed to the government. First one is the debt relaxation. The commercial bank, the government banks, as well as other financial institutions should suspend the debt as well as the interest for at least 6 months, starting from January for like 6 months in order to provide remedies to informal sectors. the Informal Worker Federation of Thailand also try to ensure the inclusivity of the migrant workers. These people probably like cannot access the technology so that they can access cash grant program or cash handout program. The other issue is we want to ensure that the public procurement from the government agency as well as Bangkok Metropolitan should get 30% of the quota for the uniform for like beddings and uniform for like cleaners in hospital or bedding in hospital. And we also propose about the recovery fund for the informal worker development in order to be the working capital for migrant workers in different sectors. Fifth, we want the government and government agencies to provide reskilling, especially on technology or like online e-commerce, as well as the online platform on product design or like on the online platform, as well as the platform for like motorcycle taxi driver or beautician. Six, we want to have food security, especially enabling the market vendor and street vendor to reopen themselves to ensure food security and access to cheap and quality food during the COVID. Seven, reduce the tuition fee or suspend tuition fee. Despite now most students study online, but we want the government to reduce the tuition fee and also provide subsidy for online education expenditure. Eighth, we want the informal sector to be represented in working groups. For example, the working group under Section 40 of the Social Security Fund, as well as the National, or like the bigger informal worker committee. The government have to set up two committees. First, the committee under Article 40 of the Social Security, that is like the committee for the social security for the informal workers. We try to actually like reduce the contribution for the informal sectors social security contribution. Currently, we contribute 60%, and we propose that the government try to reduce the social security contribution to 40%. This would help informal workers a lot. Secondly, we also propose that we can allow the workers who informal workers who suffer from the COVID to use the facility as Social Security. The second working group is the National Informal Sector Board, which is set up by the Ministry of Labor. This board is represented by different sectors of informal workers, for example, home-based workers, domestic workers, motorcycle taxi driver, who participate in this group of committee. This group of committee actually like have proposed to the government through the Ministry of Labor. We have seen that Ministry of Labor try to promote the small and medium enterprises. The Ministry of Labor allow the small enterprise to engage in the public procurement. For example, the quota for public procurement to the home-based worker group or like micro SME group or micro manufacturer group. The government also revised the home-based workers Protection Act. The enactment of Home-Based Worker Protection Act will ensure that there will be the fund to help the home-based worker, especially the informal worker. This Home-Based Worker Protection Fund will be evolved to the Universal Fund for Informal Sector. The informal sector can access low-interest loan, and this will not cover just the home-based worker, but it will be expanded to universally for informal worker. This national board will take care of the matter relevant to the informal sectors. However, we see that the government would probably like set up different policy to the Ministry of Labor. This will delay the work of Ministry of Labor in order to address the problem of the informal sector. Now, so these are the recommendations and how we have engaged with the government. So now, if Kun Poonsap would like to add anything, please feel free to do so.
ก็อาจจะเพิ่มเติมนิดนึงนะคะในแง่ที่ว่า
I'd like to add that the demands during COVID is very important, and we have to make changes. It's very obvious that informal workers are one of the last groups that the government will take care of. And during normal times, the budget of the Ministry of Labor does not actually have some budget allocated for informal workers, and so in order to do so, it would take time and it's difficult to do so. And during COVID, I think it would be a very important turning point for us to tackle long-term informal worker problems. And informal workers should get social protections and should be receiving all the assistance so that they're not left behind. And we should tackle the problem long term and not an immediate or short term.
Thank you. Thank you so much, Kun Poonsap and Kun Manop. Thank you very much. It was very, very insightful and interesting recommendations that you're making. I just wanted to turn now over to Sally and see with Sally. So we've just heard about 2 cities, Bangkok and Lima, out of the 12 that your research has been covering. So what, in your view, because you've got the kind of the bird's eye helicopter view, what are the recommendations emerging from across the study, and what's next?
Okay, thanks very much, Erin, and thanks to all my fellow panelists for such excellent presentations. I would say from that bird's eye view, one thing to keep in mind in terms of context, or a couple of things to keep in mind in terms of context. So one is obviously from what we've heard from our colleagues in Peru and Thailand, as a global community, we cannot begin to think that the pandemic is over. It's not the beginning of the end in most of the world. And I think the results presented here today and the perspectives presented here today make that very clear. I think also just to say that the results presented here today from the study reflect the experience of workers in wage employment, workers in self-employment, and workers in working arrangements that are sort of in between. And what they all have in common is extremely high exposure to risk as workers. So without any buffers that can protect them. And that was the case before the pandemic hit, and we can see the consequence. And also remember to keep in mind that the impact that we saw, for example, in Marty's slides, where we're seeing, earnings by June or, 30% or 40% or 50% what they were before the crisis hit, is impacting not only those workers, but the households that depend on them, to keep in mind the scale of the impact. I think the unifying message among workers throughout the 12 cities is that the government role should be to facilitate our ability to work. That's what they're saying in every city. Carmen made this point very forcefully, but it's a point that came through across the cities. Government role needs to be to help people get back to work. There were cases where cash grants did reach, and in those cases, the relatively small reach that they did have were helpful and are still needed both for meeting basic needs and also as working capital, as Gloria said, for the self-employed. But recovery really means being able to work and being able to rely on that work to meet needs throughout the life cycle. So how do we get there from, and what do we learn from workers' perspectives, including what works? I think building on what the previous speakers have said, I think a few points. One is better vertical coordination between national and local governments to do no harm or to reduce the negative practices that tend to deplete income and assets. And we've heard about several of those examples from our speakers. So this could happen through national urban policy processes that have worker leaders like Manop and like Gloria at the table to design policies that are more supportive of livelihoods. It could come through national government guidance to local governments on protecting assets, including workplaces, material, property, et cetera. Or it could come through national policies that recognize working conditions of particular groups outside of formal wage employment, and especially the working conditions of women within those occupational sectors. A second point that comes out is better horizontal coordination in policy settings that together shape working conditions. So for example, coordinating social protection policies with urban policies with informal livelihoods in mind. Sometimes there's a social protection policy, let's say, at national government level that could in principle be helpful, but in practice doesn't become helpful because of urban policies. Another example, recognition that informal workers of all kinds, as we've heard, face prohibitive administrative barriers to access not only relief like emergency cash grants, but also even things that they needed outside of crisis context, like business licenses and things like that. And the best way to address those barriers is to work with representative organizations, such as the ones led by Manop and Gloria. And another is to recognize that informal wage workers, like domestic workers, often earn wages that are insufficient to cover their basic needs as well. So that's the second thing. And third thing is really much more proactive shaping of markets for recovery in support of workers from a bottom-up sort of worker point of view perspective. So working with workers who provide essential goods and services to troubleshoot the public health hurdles. So Gloria's organization knows exactly how to set up a market so that you can protect public health. So working with those organizations that have the know-how, support with practical things, sourcing raw materials for production, shaping markets, and so on, and really drawing on that know-how that worker leaders, such as my colleagues, have. Thanks very much.
Thanks so much, Sally. Really good. Well, can you believe we've come to the end of our panelist discussion, but now, and I want to thank all the panelists for your preparation and your wonderful presentations at the very different levels that give us really a wide overview, but also some of the on-the-ground realities that informal workers are facing. But now we get to turn over to some Q&A, and I've got some questions that have come in here. So let me just start, if I can. Let me see. The first one is actually for Marty, and it's from Jana Schmalzer. And here is the question. So based on these results that you presented, what would be your recommendation to governments to address these triple disadvantages that informal workers now face, especially provided that many developing countries, in many developing countries, the informal sector is a large part of the economy? I know that some of this has already been covered by some of the panelists, but would you have anything more to add on that?
Thank you for the question, a very important one. I think my colleagues have emphasized the importance of continuing cash grants, not just for relief and basic needs, but for recovery. So that would deal with, help deal, let's say, with at least two of the handicaps, the increased debt and the depleted assets. But on the payments, I think we need to unpack, especially the utilities and the school fees, and perhaps also the rent, because we find that people are paying these fees or postponing them, but being obliged to pay them even when they weren't going to school or even when it was online. And I think Manop mentioned the importance of subsidy for online. So we need to think through how the poor access these basic services of housing, of utilities and school during this kind of crisis. But what we've also heard from Poonsap quite clearly is that we need to look at the broader reforms in urban plans and governance and national plans and governance, and the links between the two, as Sally pointed out, because for their ability to work, it depends largely on that local government, what the local government's stance is. Do they protect the markets? Do they allow them to work? Do they provide the public transport for the live-out domestic workers? So much depends on local governments' willingness to build them into their plans for markets, for transport, and so much more. Thank you.
Thank you, Marty. So we just have a few minutes left, but we will are still able to get in some more questions. So this next question comes from Dili Pudel, and I think I will ask maybe I will ask Carmen or Sally, because it's a kind of an overall question. It's about domestic violence. And the question is, so did domestic violence increase during the pandemic? And if it did, how did it impact? And sorry, that's the first question, which I think we know the answer to. But the second one is, and how did the pandemic impact on child education? Maybe Carmen, can I ask you to take a stab at that first?
Yes, there was a big fear that domestic violence would increase, and it did. And shelters and measures like those have been implemented. But it's difficult to get very accurate data when you have a country under lockdown for 5 months. And about children's education, in the case of Peru, we've had the whole of the school calendar year last year and this year being online. And as Sally and Marty pointed out, even if you have the state TV channel providing education on different schedules for different grades of schooling, you still need to be in touch with your teacher via WhatsApp or some way to know what to do with that information, or to make sure that you are, attending the lessons. And if you have to prioritize food, you don't put any balance on your prepaid phone. And that is the reality everywhere. So definitely affected. In some countries, they say it's a lost year in the education of children. But at the same time, people speak about, the resilience of children, trying to adapt, trying to do the best in the ways they can, but definitely affected.
Thank you. Sally?
Yeah, thanks, Erin. I would say across the cities and throughout both the quantitative data and the qualitative data, all of it reflects what Carmen has said about Peru, which is certainly an increase in domestic violence. And we've heard a lot about that from our partners really quite early on in the pandemic. So unfortunately not surprising, but that was a big burden. And I should also maybe connect it with a point that came up earlier in the chat, which was that the crisis has not only had an impact on, earnings and ability to work and those things, but the sort of mental health and emotional toll that it's taken. And that really came through particularly the in-depth interviews that our study teams conducted with worker leaders and with informal workers and other key informants throughout the cities. Not only that the sort of mental and emotional toll that violence took, but really the whole situation. And worker leaders in particular were having to shoulder the responsibility of not only keeping themselves and their families afloat, but also, working with their membership and putting time into, making calls and checking in with people and doing all that work to keep everyone's hope in place, and so that is certainly one of the effects that we see through the qualitative data in particular.
Thank you, Sally. I'm just going to squeeze in one more question, and it's about the elderly and about how you know, we've said, I think many have said that the informal workers are definitely not a heterogeneous group, or they are very varied, and certainly in gender, but also in age. So I will ask maybe Manoj, Poonsap actually, to answer this question. It is from Kate Horsted. And she said, can you say a little more about the specific challenges that older people face in returning to work? And about, maybe you can talk about that in your particular situation in Thailand. And if we have one more minute, we'll ask somebody from WIEGO to say how older women's care workload has increased, and whether it has increased. So, Poonsap, are you still with us?
Yes. Yes. ผู้หญิงที่เป็นแรงงานนอกระบบสูงอายุปัญหาก็คือเรื่องของการอาชีพ
Women informal workers actually like
เขาจะไป
suffer
เปลี่ยน
a
อา
lot
ชีพมันไม่ใช่
from
เรื่อง
the
ง่ายเนื่องจากเขา
livelihood.
สูง
It's
อายุ
not
แล้ว
possible for
นะคะ
them
อย่าง
to
เช่นที่มาน
actually
พ
like
พูดว่า
change their
จาก
career
home based worker
because
ไป
they
เป็น
are
street
already
vendor ต้องไป
old.
ขายของ
So
ขายอาหาร
just
แต่
like
เขาไม่
Manop
ได้มี
have
สกิ
said
ล
that they
ใน
don't
การ
have the
ขายอาหาร
skill. For
อะไรอย่างเงี้ย
example, the
เพราะฉะนั้น
older
นี่
garment
คือสิ่งที่เรา
workers
พบ
who
ว่า
turn to like street
เรื่องของ
vendor
การ
does not have the skill
มี
of the
รายได้
trade
การ
for
ทำมา
like
หากิน
street
เนี่ยจะเป็นเรื่
vending.
องลำบาก
So
มาก
that is
ที่
the
เขาจะต้องปรับตัว
difficulty in terms of the livelihood, and that they have to adapt a lot in order to survive.
Thank you very much. And Sally, do you want to have an overview on the elderly or more elder informal workers?
I would just add that as was the case with the pathways that Marty described, the impact on older workers also varied by sector. So with domestic workers, for example, we heard from a lot of domestic workers who would say things like, you know, I've been working for the same family for 25 years or 30 years. I raised their kids, I've cleaned their house, and the pandemic hit and they just said goodbye and not to come back. And that was the end of the relationship. That was, and so those older workers, those older domestic workers really have very little chance of, you know, getting back to work. And that's why we see the effect that Marty showed in those charts at the beginning, that quite a few domestic workers have not been able to get back to work, and quite a few of them have been older workers. Similarly, in some places, there were government restrictions on working in public space specifically for older workers. So older people in Peru over you know, a certain age were not allowed out. And so, and yet they don't have pensions. They don't, you know, they don't have a source of income in older age. And so going out is the only way that they can earn. So those older workers were also put in an impossible situation. So again, kind of looking at it from one sector to another, you can see how the effects among different age groups kind of play out depending on what their employment situation is.
Thank you, Sally. And here we are with 1 minute left of this really fascinating webinar. I just wanted to take a moment to thank again our panelists and everyone at WIEGO that did the research and together with the local organizations that gathered the data, and of course the participants and your active you know, questions and engagement throughout this discussion. I think that, well, of course, I want to say that the report from the second wave of data collection will be released sometime around October or November at the city level, with the full report to follow after that. So keep an eye out for that. As I mentioned earlier as well, the information is on, the reports are on the WIEGO and the IDRC website. So with that, I wish you all a very good day, evening, or night, and I hope to hear from you soon. So thank you so much.